Thank you all for joining us here this afternoon. I'm grateful to have with me today Health Services Director Dr. Kara Christ, Wendy Smith-Reeve, our Director of Emergency Management, Dana Kennedy of the AARP, and Dave Voipol of the Arizona Healthcare Association. As I stated earlier this week, protecting public health is our top priority. When it comes to COVID-19, we've followed the facts and we've followed the advice of our top health professionals, the Department of Health and Human Services, the Centers for Disease Control and Prevention, and the World Health Organization. This morning, the Department of Health Services announced 3 additional presumptive positive cases of COVID-19, bringing Arizona's total to 9. And the World Health Organization declared COVID-19 a global pandemic. Our approach has been to be calm, steady, and transparent, and to act with urgency to protect public health. This approach allowed Arizona to become one of the first states in the nation to be certified by the CDC to test for COVID-19. We've been conducting regular briefings, webinars, and providing guidance to community stakeholders, including school administrators, healthcare providers, government officials, and business leaders. We've also coordinated closely with experts on the ground, including hospitals, nursing home facilities, and local health officials. Their input has helped guide our actions, and we're grateful for their partnership. While Arizona is not currently facing the number of cases we've seen in some other states, we are anticipating additional positive cases, and we're not taking any chances. This is about public health and protecting lives, especially those of our elderly and most vulnerable. That's why today I'm taking additional actions. The first is a procedural step to remain ahead of the virus. I'm declaring a declaration of public health emergency. Here's what the declaration does. It allows the state to quickly tap into additional public health emergency resources when needed to combat the virus. It allows the state to waive licensing requirements to provide healthcare officials with assistance in delivering services during times of heightened demand. It provides hospital and healthcare facilities, such as nursing homes, the flexibility to implement enhanced safety protocols. And it gives health officials additional authorities to procure needed medical supplies. This is a proactive measure, and it ensures that Dr. Christ and her team will have all the tools and resources that they need to protect Arizonans. The second action comes from discussions with our healthcare professionals and healthcare providers. It's an executive order aimed to protect those most at risk for COVID-19, our elderly citizens and those with underlying health conditions. Here's what my executive order does. It requires nursing homes and assisted living facilities to implement visitor policies, including enhanced symptom checks for all healthcare workers and visitors. This will allow Arizonans to continue to visit their loved ones while protecting those most at risk. It requires insurance companies and health plans to cover out-of-network providers, including laboratories and telemedicine for COVID-19 testing. It protects consumers by prohibiting price gouging of testing for COVID-19. And it requires insurance companies to cover 100% of the cost of testing. Some may ask, why now? Why today? Here's why. This is an important proactive action. To date, we have not had community spread at a nursing home or elder care facility, but we could. And if that happens, we want DHS to be equipped to act immediately and with urgency. At the same time, we know there's more that can be done right now to protect vulnerable populations and that's what this executive order does. These are our latest steps, and they will not be our last steps. This will continue to be my top priority 24/7. But nothing here today should be misinterpreted. These are continue to follow the Department of Health Services guidelines on how to stay healthy at azhealth.gov. We will continue our approach of being calm and steady in our efforts to protect public health, and we'll continue to provide facts as we have them in a timely and transparent manner. And we need the help of community leaders, our partners, and the media to ensure all Arizonans understand the risks and the facts.